A nurse begins with what seems to be an impossible dream. That nurse begins her journey with analyzing the essential roles that will assist her in becoming advanced practice nurse, family nurse practitioner.
Dream the impossible dream.
How do you think the Affordable Care Act is going to impact these APRN roles?
I think it's going to impact all four of the roles, again, very significantly. The nurse practitioner role is going to have an opportunity to really come to the fore in much of the advanced the CARE Act itself, primarily because of their impact on primary care and their ability to provide direct patient care. Clinical nurse specialists are also going to have a tremendous impact on the Affordable Care Act because as specialists who deal with population foci, they can enhance the care that is provided by the nurse practitioners. The nurse midwives clearly also have a specialized population that they're addressing that has tremendous needs within our population. Within the country overall, as well as internationally. And one of the chapters in the text does address specifically the nurse midwife role in Africa and what's happening there and how health policy does and can impact the nurse midwife role. The nurse anesthetists I see having a higher impact on pain management as well as on a variety of areas with access to care for minor surgical procedures, et cetera, as well as the major surgical procedures. So I think that the Affordable Care Act is going to provide opportunities for each and every one of the roles. It's also going to present some challenges. It's going to present some opportunities for each of the advanced practice roles to really step in, look at how the Affordable Care Act is being implemented within their state or within their region, and then to address the issues and concerns relevant to that particular role. So I really encourage each one of the advanced practice roles to stop, take a look at how the impact is going to be played out within their state and within their region and within their particular discipline.
Dream the impossible dream.
The physician is educated different than I am, and I do believe that they have
in what way? I mean, what's your perception of how their education is different from you? I mean, I hope you don't mind us having this little conversation, because I think it goes directly to the issues we're talking about.
No, I think that when I collaborate with a physician, that physician has been with me for a month. They know what my capabilities are.
But I was talking about training now. I mean, how do you perceive the training that your doctor has had and what you have had? Is they on a par, or has his been or her been more? Or
it's been different. I got a diploma from Barnes Hospital in 1973. I went to Washington University School of Medicine to become a psychiatric nurse practitioner. I went to Maryville and got a bachelor's degree. I went to Mizzou and got a family and geriatric NP, along with a master's of science. And I went to St. Louis University to get my doctorate of nursing practice. So I've had a lot of education. So to compare year to year, my education is different. I'm a nurse practitioner, they're a physician. But I have lots of education and lots of clinical experience. I've been a nurse since 1973.
Dream the impossible dream.
Untreated when treatment was available.
It was for the greater good.
Who's good, Miss Evers? Who has benefited?
We proved that there's no difference between how blacks and whites respond to syphilis. The benefit of that...
If they were white, Miss Evers, if they were white, would these men have been treated as they were? You should know better than anyone.
Yes, I do, Senator. If they had been white, your public health service would never have agreed to do this study in the first place. They wouldn't have dared. If they had been white, you congressmen wouldn't have voted every year for 40 years. If they had been white, somebody would have said something before now, because everybody knew what was going on. It wasn't no secret. But because they were black, nobody cared. Because they were black, the U.S. government, thought that they were expendable. Now you're trying to push the blame off on me and the fine doctors who did the best we could with the choice you gave us to make. Whether to leave those men in neglect or to give him the best care that was within our power to give. Nursing them men was my life, mister.
Dream the impossible dream.
In the personal story segment tonight, nurse Jill Stanek testified in front of the House of Representatives before that body passed the Born Alive Infant Protection Act. Ms. Stanek works at the Christ Hospital in Oak Lawn, Illinois, where, according to her, some babies have been birthed and then were allowed to die. Ms. Stanek joins us now from Chicago. It says, you know, most Americans don't even know this story because the mainstream media isn't covering it. I think we're the only ones on television covering it. And as you know, the ban on this passed overwhelmingly in the House of Representatives,
right.
the Infant Alive Protection Act. But I was stunned to hear that there are babies being allowed to starve to death. Is that what's going on?
They probably don't live long enough to starve to death, but they are being aborted, oftentimes alive and allowed to die, yes.
When you say oftentimes, talk about your personal knowledge of this. You work in a hospital called Christ Hospital. Is that a religious hospital?
Yes, it's associated with the Evangelical Lutheran Church of America and United Church of Christ. And
they allow abortions.
I was very shocked to find out after this all started that they are a pro-choice denomination.
Dream the impossible dream.
Welcome back to Fox and Friends, 16 minutes now past the hour. Well, should your nurse become your primary care provider? In 28 states right now, nurse practitioners may soon have the power to do just that. That's because those states are looking to fill a future doctor shortage by giving nurses that same authority. Here for a fair and balanced debate on this issue is Susan Ahold. She's a doctor and a nurse practitioner, and Dr. Mario Mata. He's a cardiologist and president of the Massachusetts Medical Society. Welcome to both of you doctors this morning.
Good morning.
Dr. Ahold, let me start with you this morning. Why should nurses be allowed to play doctor?
Well, actually, nurses don't want to play doctor. Nurses want to be nurse practitioners. The real point here is that nurse practitioners provide safe, effective, quality care, and we've been doing that for over 40 years. What we're seeking to do is continue to practice safe, quality care autonomously with no barriers or restrictions to our practice.
Dr. Mata, that sounds fair and reasonable. What's the problem here?
We have no problem with nurse practitioners fulfilling the role that they're designed to do. And there's quite frankly a need, and there's an expanding role for them. The only issue of controversy is whether they should have an independent practice.
Dream the impossible dream.
A lot of primary care can be effectively provided by advanced practice nurses, particularly for the vast majority of us.
We're nurses with extensive knowledge and experience,
graduate level education,
and advanced certification.
We are advanced practice registered nurses.
State boards of nursing protect the public by licensing advanced practice registered nurses. Support our efforts to unify regulatory standards
so we can continue to provide quality care
and give you greater access.
And during this journey, the dream is obtained with developing all the essential roles of becoming an advanced practice nurse.
To reach the